Good morning all, it's me Geeta Sanu from Plus Academy Tiruvalla. ഇന്നത്തെ വീഡിയോയിൽ നമ്മൾ പറയാൻ പോകുന്നത് പ്ലസൻഡ പ്രീവിയ എന്ന് പറയുന്ന ഒരു മറ്റേണിറ്റിയിലെ കണ്ടീഷനെ കുറിച്ചാണ്. പ്ലസൻഡ പ്രീവിയ. Normally, placenta develops in the upper uterine segment. But in this condition, placenta is developing in the lower uterine segment and causing so many complications during pregnancy, like antepartum hemorrhage. During delivery also, intrapartum hemorrhage can occur, and in the postpartum period also, bleeding can occur. ഈ പ്ലസൻഡ പ്രീവിയ തന്നെ പല വിധത്തിൽ ഉണ്ടാവാം. Central placenta previa. Central placenta previa is the serious form of placenta previa in which the placenta covers the internal os fully when the cervix is dilating. So it is causing severe bleeding as the cervix is getting dilated. രണ്ടാമത്തെ തരം പ്ലസൻഡ പ്രീവിയ എന്ന് പറയുന്നത് പാർഷ്യൽ പ്ലസൻഡ പ്രീവിയ ആണ്. In this condition, placenta covers only 3 cm of the internal os. In this condition also, as the cervix is dilating, there can be chance of bleeding. മൂന്നാമത്തെ തരം മാർജിനൽ പ്ലസൻഡ പ്രീവിയ എന്നാണ് പറയുന്നത്. In this condition, placenta is not covering the internal os. Only thing, it is in the lower uterine segment. So, എന്താണ് assessment findings placenta previa? So, as the cervix is dilating, the placenta also will get separated, causing severe bleeding, and also fetal oxygenation will be affected, causing hypoxia of the fetus. So, depending on the type of placenta, the severity of bleeding will vary. Also, the patients in this condition, even though there is severe bleeding, it is painless. So one of the typical feature of placenta previa is painless bright red vaginal bleeding. Along with that one, fetal signs of fetal hypoxia will be there, and depending on the amount of bleeding, there will be signs of shock also will be there. So how we can manage this condition? In placenta previa, we have to provide bed rest to the patient. In addition to that one, anything that will stimulate the uterus should be avoided. For example, vaginal examinations are contraindicated, and also anything that causes stimulation of the uterus should be avoided in this condition. And depending on the condition of the fetus, sometimes cesarean section is needed immediately, and the amount of bleeding will decide the type of fluid to be given, and severe bleeding we will give blood transfusion and also IV fluid. Thank you.